Hey, this is Christina Feliciano with Feliciano and Friends with Dr. Raj. He is a psychiatrist that has his own practice here at Jacksonville Beach that is growing, evolving. He's doing a lot of really amazing things for the community, helping so many people with mental health. So he's going to talk about everything that he's doing and educate us. So thank you for coming.
Of course. Thanks for having me.
So give us a little background. What brought you into psychiatry?
All right. Well, the first things I think about when you ask are like Frasier. Like, I really love that show. Also, I was in the military. Like, when I joined college, I was in the medical unit in University of Iowa, and I would see a lot of PTSD. I was actually in a training in Hawaii, of all places. Med lab tech was my job, my Army job, and that's when like my unit went to Iraq the first time.
Okay.
In '02 or '03, and then, you know, when people came back, a Humvee would backfire. Mm-hmm. They would jump.
Yes.
Like, you know, someone would tap on the back of the shoulder, jump. So it was kind of the first time I was really exposed to a lot of PTSD. And I was always interested in psychology, but the idea of like therapy plus, I don't know, just, it's a very interesting. It's like one of those fields you could talk about at a party and like people are interested in the stories, right? And like medicine, what are those labs? Less so, right?
Yeah, no, for sure. So for your business, I know that you do kind of concierge service. So do you do all sorts of psychiatry, or do you specialize in something in particular?
Yeah, so after I did my adult general psychiatry training in New York, then I did 2 years, that's 4 years. Then I did 2 years of child and adolescent psychiatry in Charleston at Medical University of South Carolina.
Okay.
So I specialize in child psychiatry. I was always like really love kids. I'm a big brother, 8 years older, so felt like I kind of half raised my brother, baby bro.
Oh, that's cool.
And I don't know, I just always, now I got young kids myself. It made me think twice. Do I really want them? Like, I always thought when I was an inpatient, like in child psychiatry in a very tough unit for months on end. Then one of my colleagues, Lauren, I remember saying like, well, we were seeing kind of like a certain subset of these, because it'd be the same ones over and over if you go to inpatient unit. And I was like, what if our kids like, do we really want to have kids?
Right.
And so anyways, mine are pretty good and they're pretty easy comparatively. But now I do general psychiatry. I see all comers.
Okay.
And, you know, we'll do also like labs, because I think a lot of times
what's like your philosophy, because I know that you're a little bit different than most psychiatrists. So what is your philosophy behind mental health? Like, what is your...
Right. So like my whole thing is like when I first worked in most of your training and then my first job out of practice, it was or out of residency, I'm sorry, my first practice was insurance based. So it was very like, you see patients for a short period of time, like 30-minute evaluation, 15 minutes follow-ups, and then like the parts that I loved, I did a lot of training in therapy, and I just always took to wanting to know the whole person.
Yes.
Not just the biological, the medicine, and the brain, but like also the psychology and the relationships and what do they want from life and the whole big picture. So it was kind of encouraged, like, you'll see people for a short period of time as a doctor, and then they'll go see the therapist for longer periods of time. And that's how like most of the healthcare system is. And I was like, I was not getting as much fulfillment from it. I found myself like going past those 15 minutes, those 30 minutes. I wanted to keep talking to them longer and working with the whole family and so on. So now I do get to do that. So by doing more like concierge, cash pay practice, which is grown, I think, with therapists especially, and even in psychiatry, we get to go a little deeper. And a lot of the patients I see, they want to come to one-stop shop for the psychiatry, like the med management, therapy, but even just like, you got to rule out all the medical things, as you know.
Yeah, for sure.
And that's often not done. Like,
so give an example of something that may be like medical condition that might be presenting as a psychiatric issue, but has more of like a biological or medical component.
Well, definitely like hormone issues for sure. Like we call it PMDD, premenstrual disorder for young women, like when they're around their periods.
Yes.
Having like more ups and downs, depression, anxiety.
Yes.
And they tend to have more like than postpartum depression, and then a lot of perimenopausal symptoms, and then postmenopausal, of course, and then a lot of like endocrine things like hormone related, which I know you deal with a lot.
I do more men though than female.
Okay,
so
got you.
In men,
yeah. So like,
but I am a female, so I know a little bit about female hormones.
Right. So that can be, also autoimmune conditions like and endocrine, so thyroid, and autoimmune stuff like lupus or like Lyme disease, sometimes like infectious diseases. So a lot of these things aren't picked up, and they're medical conditions that have psychiatric symptoms, right? So first we have to rule out, is it like substance related or medical?
Yes.
And often that's like missed. And so you're kind of using antidepressants or like antipsychotics or mood stabilizers for things. You're not getting to the root cause.
Okay. So
and I feel like that's the problem with a lot of medicine. We're never getting to the root causes.
No, I agree with that.
Healing it.
And so in your opinion, would you say like there's like usually like 3 root causes of mental illness? Would you, again, this isn't, correct me, substance, biological, like medical, and then trauma? Or is there more than those 3 that you think would contribute?
Yeah, I think with trauma, I think there's like big T trauma, like abuse, bullying, right? But then there's even like little T trauma, like did you fail out of school, like immigration, it was considered like a little T trauma.
Okay.
So it's not just those kind of like huge, there's like a scale called ACEs, adverse childhood experiences. So like physical or sexual abuse or, bullying and things like that. But then there's all the like breakups and got fired and, fail out of school, like these little traumas too, right? And, or, maybe an affair or something like that, right? And so these things definitely, if you include element trauma, for sure, psychological, so much psychological kind of baggage that stays with you, right? Then there's the biology, and I think we underestimate how much is like genetics and just temperament you're born with, right? Like anyone that's had kiddos, you have more than one, you see like they're in the same environment, but they're totally different, right? And I'm sorry, what was the third one you asked about? Medical?
So medical causes.
Yeah. So I think that's a pretty good summation. I would say, I think nowadays, like, I was thinking a lot because a friend of mine this morning who also has a daughter about my daughter's age was like, did you see in Illinois they're gonna do this depression scale on the students, or they're thinking about it, like, and this is something they were considering for years, but it was like, is it really needed? Is it worth, like, we should only just do it maybe when there's something suspected.
Yes.
But now it's kind of like more awareness of mental health, and I think the numbers are going up, especially in young people. So it's like, let's screen and try to be proactive, which is kind of good.
Yeah, no, for sure.
So I think there's just more society like being more on our phones and our screens. There's things about society, like just less exercise, more screens, the food.
Yeah, I would speculate less community, more isolation too.
Correct.
Because your clientele, I would assume, are going to be probably more middle to upper class if it's concierge and private pay. So then I would suspect that there's probably a lot of just isolation. Yeah,
I think isolation, loneliness, and like we say, there's a saying like the opposite of addiction is connection.
Yes.
Right? So they've done studies where they took people who were like, say, alcoholics or some kind of addiction, and instead of medicine or even like going to AA or something like that, Alcoholics Anonymous, like they're working together in the field. So they're like touching grass and they're working in their community.
Yeah, for sure.
And I think that's one of the biggest reasons AA is considered the gold standard too, right?
No,
it's like just you're not alone. Community.
Yeah, exactly.
Correct. And like, of course, the contingency of a sponsor, I think, also is very helpful.
Yeah.
Like for those tough moments, there's someone that's there for you, and then this group that's there for you, right? And just sharing, you're not alone.
Yeah, no, for sure.
That's why it's so effective.
And then, so what do you do? I know you do some work with psychedelics. You want to talk about that?
Sure. So the reason I got into psychedelic assisted therapy, I was never like a psychonaut or something. Like I have a lot of patients that come in, they're like, tried all mushrooms.
Yes.
Like when you ask about kind of your substance history, LSD and this and that. And so to me, like I was like, just say no. Like grew up with the dare, dare and the frying pan, the eggs on it. Like So I'd say like no when asked or whatever. But what happened is like I started seeing a lot of my patients who were really smart, and the medicine would help maybe stabilize their panic attacks and their depression. Say like one I'm thinking about in particular, she just finished college, like super smart, like she would put herself in these same positions. Like a lot of times it's the trauma, as we were saying, right? Like she would put herself in these positions with men who was kind of related to an earlier trauma. And it's like we're trying to like rewrite the script is how the theory goes. Okay. Like a repetition compulsion. And I was like, okay, so like you just get used to this 6th vital sign, we call it. There's like 5 major vital signs, like blood pressure, heart rate, temperature, right? But and pain is 5th, and the 6th is like trauma. Okay. So like it's like the universal precautions almost you got to use in psychiatry or therapy and mental health is like the traumas, like you said. It's so common, and it's like, how do we actually heal the trauma though? Because it's very hard to talk about, because part of PTSD is avoidance and avoiding to think about it and talk about it, right? There's shame, a lot of shame often in it, and it's also like hard to change behavior and how you think about things. That's why people can go for years of therapy and like maybe not change their behavior, right? And so, but psychedelics have some special qualities about it. So ketamine assisted therapy is the one that's kind of legalized right now federally. There's other, and some are like debate, is this even a real psychedelic? It's not natural. In any case, like it has these qualities. It increases feelings of connection with others. And same with like psilocybin, like magic mushrooms. Yes. MDMA, which is like ecstasy or Molly, right? The rave drug. LSD as well. The kind of the big ones, ibogaine. So they're allowing you to like really like go through the tunnel of. We say the only way to the other side of the tunnel to heal the trauma is to go through it, and a lot of times where there's avoidance to that, but like during the first ketamine journey, it was like just in that journey going working through that trauma, and that's kind of goes for a lot of people. Like it's like we basically have an intention before starting the psychedelic therapy, and we say like you don't know how you're gonna get there, but usually like you're gonna get to that intention. So you just
have like this big trip and then you're better at the end of it?
In a way, it's like guided trip in a way, because you're going through it, but like the difference is like we call it like a therapeutic envelope. So then is it like or a therapeutic container when you have like a therapist with you guiding it.
So when you're guided, so is the theory then that like the neuroelectrons are just gonna like change the pathway? So when you get out of it, like now you have a healthier brain because you've like
so we call that like neuroplasticity. So there's like new neurons, new dendrites, which is like what connects the neurons. Yes. And so in a way, like new pathways emerge. Like you see things creatively that you didn't see before, and that's why like in Silicon Valley, entrepreneur founders, they talk about like, oh, I'm gonna use mushrooms or LSD. Like Steve Jobs is kind of like a famous example. Like you see new things in creative ways and so on. And then the other thing is just the ego disillusion. So going back to connection, like it directly helps with feelings of connection, because when people are going through a psychedelic experience, they're often like they were complaining about their wife or their kids or mom or dad, but like now they're like, I miss them. They're like, I see my dad, who passed away, and I'm so grateful. Like I'm imagining playing catch with them as a child, and they kind of like let down your guard, so to speak, that ego disillusion. And the ego is such a big hindrance too to like us being able to connect, which is where so much that's just good for all mental health, right? Depression, anxiety, as we said.
Yeah, no, for sure.
And so now you kind of go through life with a little more gratitude for the people like in your life.
So what about someone that's been like abused substances? What would they do?
Well, that's a tricky one, because sometimes like you want to make sure they're not using it just to get high. Yeah. Right? Or tripping like and their brain is wired to kind of more likely to get addicted to that thing. So that's where it's good to have like the therapeutic container of, and that's a really good question, because it's also some could be used for treatment. I'm in like
recovery, and I would think for myself like, I'm going to get high, I'm going to enjoy the experience, I'm going to feel better, but that's like what I'm also trying to avoid. I'm trying to live life not being using, not using the crutch of feeling I hear you. Of going to there.
Yeah, and so, I think like you do yoga, right? Like
I do. Yes.
So like I think there's ways you can get these same feelings of
That's
connection.
That's what I'm trying to do. Actually, it's interesting you say that, because I've been trying to find ways between working out and nature. Of like, what are ways that me in recovery that knows that drugs is probably not the best thing, because then I will just like the whole like NA will talk about like one is never enough. You know, because I'll just want more and more, and I want to just feel good just stay in that feeling good, and then it will be super self-destructive for me from past experience. That's what happens. Like it's good for a period, and then I can't stop. So I'm trying to like learn to try to teach others like these are maybe other ways, because
agreed. I think that's a safer. I think it's a safer route for the most part. Yeah, I hear you. So. I think like I wouldn't give someone who has this history of addiction. They almost like it so much for escape. Yeah, it's like the intention behind it, right? Exactly. The why. So. Like that's like you know, they're using it where you're treating your depression, anxiety with, you know, as an escape hatch. Then I would not give them like troches or like kind of the pills that dissolve in your mouth to take it home. Like that was kind of the Matthew Perry famous case, right? Like he was having it at home and then drowning. It's like that was irresponsible, and that's why the doctor went to jail for it, right? It's like
that'd be me. Don't give me anything.
No, right, but that's good to know about yourself. I agree. So like I think this on the safe side, we would avoid giving it to someone with a severe addiction. Yeah. But then there's like, for instance, someone I know in town, she said how Ibogaine helped save his life.
No, for sure. I mean, there's experience.
Because he was opioids, alcohol, and like now he doesn't drink. So like there's kind of like, it's a little bit tricky.
And I have heard even people that are in recovery that have had some with like the ashwagandha, or is it not ashwagandha,
like mushroom, like psilocybin.
It's a really strong, where it's almost like changed their where they wanted to even go back there.
Exactly. So like to me, it's like if you can get to the root cause of what led to the drinking or the substance use. Like granted, there's like it's like multifactorial, right?
For sure.
There's like the addiction, like genetic. It's very genetic, their tendency, but then it's also like. It's kind of like, I think the analogy is like a loaded gun, we say, for like even schizophrenia, it's the same thing. Like it's loaded, and then if they smoke marijuana or something like that, now you can like, it's pulling the trigger. So it's like, it's kind of like two hits, right? So if the gun's already loaded, we got to be more careful, like genetically, I mean, right? But then there's also like, what if we can heal the trauma that kind of leads the person to keep drinking or using to deal with the shame. You know what I mean? To deal with the shame. So what if we can like work through that? That's the thing. Like so now the person's making different choices because there's new pathways in the brain, and they're able to change their thoughts and their actions. So there's actually like learning that happens.
That's awesome. And so can people recover from trauma and PTSD?
Absolutely. Okay. And I like EMDR.
Yes, I'm familiar. I've never done it, but I'm familiar.
That's eye movement desensitization. It sounds like woo-woo.
How long does that take to work usually?
So usually, with all trauma therapy, there's like a little bit of like, let's kind of have to build a little bit of a trust. So you can open up, and then what EMDR does is it seems like really woo-woo. Like I think everyone the first time they hear it, like what? Like this sounds like hypnosis or something. Okay, so it's like basically, the therapist kind of
I've heard really
can use a pen or absolutely. Yeah. It might be a pen, a finger. It doesn't matter that much. What matters is like the eye movement. The eyes, there's an optic nerve. It goes back, and there's like pathways in the brain that it goes right to the brain and the memory centers and the hippocampus, we call it. And then there's these memories like the therapy tries to get to, but it's often very hard because of the avoidance. We don't want to talk about it, think about it, right? But with EMDR, like it'll be like, ooh, I'm feeling very anxious. So that maybe that memory came up when the finger is like, say, right here. Yes. So the idea is like, okay, now it's kind of trigger that memory, and we're gonna not forget this happened to you, but we're gonna like kind of take the weight off by like disconnecting the emotion, that anxiety or depression, that panic almost that can happen, right? When you have that kind of trigger, something that triggers it, or that even a memory of what happened before, the trauma. We're going to kind of be able to have that memory without so much of this like negative valence of emotion with it. And so it can just become, and then, you know, they'll also be teaching skills often, the really good therapists, EMDR therapists, of like hypnosis and things like that to like calm yourself. And now the person is normally triggered and they're like on high alert, and they're like calm. So like I'm a really big proponent with EMDR, and the thing is like EMDR, or there's another thing called TMS. Okay. It's like magnets on the brain. Okay. And all of these treatments and just regular talk therapy, they will work better often when the psychedelic therapy is happening too, because again, like your mind is open right after the psychedelic.
Yeah, for sure.
For like a few days, you could say, to new experiences, new therapy. So like usually after we do the ketamine therapy, like say there's like 6 treatments we do, about an hour each, or an hour and a half, week apart. Like I try to say like do it like Thursday, Friday, if they're off on the weekend. Now you can go like have really good nutrition, like you have the smoothie across the street, like really healthy like food, clean, go to the beach or go for a hike, like journal, like it's about the integration. So you don't have to keep doing psychedelic therapy. Like going back to your question about the addiction, it's like you would be able to tap back into what was the experience and the lesson you had from it.
Okay.
And even years later, you're like, oh yeah, and then like you would have made actually an emotional shift and change.
That's really interesting. And then, with not too much time, quickly touch on peptides.
Okay.
And I know we don't have too much time because this is like an hour-long conversation, but your opinion about peptides and mental health and how it can help.
Absolutely. So actually, I'm actually pretty new to peptides, but what got me into it was the GLP-1s.
Yes.
You've been working with for way longer.
Yeah,
I mean,
almost 4 years.
Yeah, like so when they first came out, we're like, this is incredible, right? Like 25% weight loss with Manjaro, Ozempic, like everyone's kind of heard of these now. And they're not going away, of course. They're only going to grow with the obesity issues and diabetes issues, right? But what happened, so these are peptides. So peptides, what's different about them than like medications or hormones is they're affecting in your cell like DNA synthesis, protein synthesis, right? So they're kind of, to me, it fits the same, like my through line is like, just try to heal and let's improve health.
Yes, for
rather
sure.
than, because a lot of times medicine becomes just about treat disease.
Yeah, and symptom really.
Correct. And like it feels like putting Band-Aids on things when they're wrong.
Yeah.
And we're really good at that in America, but we're not always so great at like prevention and like healing, right? And that's why, we can have not the best outcomes, even though we're like the richest country, right?
For sure.
So peptides, so like GLP-1s were like, okay, like this is amazing with the weight loss and the insulin sensitivity, which like allows sugar to get in the cells.
Yes.
So there's like more energy. But then we also saw, as you know, not drinking, people who were drinking, they're like, and they're also like got lots of weight because of that. It's like they're not smoking either. Like I'm making better decisions. So like the craving of food got reduced, but also the craving of drugs and alcohol or just other addictive behaviors, right? Things that could be addictive or craving. Then you also saw like often anxiety and depression and ADHD people say is better. So it's like, oh, the cell, a lot of it's like inflammation reduction. Cells are better. So it's like, okay, what else can peptides do? So that got me to like BPC, TB is one a lot for like injury healing. And a lot of athletes use it after an injury. I had an injury, my wife had surgery, like it helped heal a lot quicker. And just, there's other ones for anxiety too. Solank.
Okay, I'm not familiar with that.
So I have some patients that they've been on a lot of meds and they still had panic attacks and things like that. And they were just using medicine to kind of abort the panic when it would happen, like a rescue medicine. And now they don't have them. They're just so much calmer when I see them. And it's like they have this peptide that is going into the cell and somehow just helping them have less anxiety.
Yeah, no, I really.
So to me, it like fits that inside out kind of healing.
Do you use like some like Samorelin at all?
Yes,
okay,
yes. And yeah. The Relins are like, so again, it's like increase your natural growth hormone production.
Yeah, for sure.
To improve sleep.
Yes.
And so I like the idea of like, I mean, you're still giving something, but exactly. NAD, glutathione for longevity. I think that's gonna be, obviously that trend is growing. I think we're gonna live longer and, we're gonna almost have these solutions to kind of live maybe, who knows how much longer. We've done studies with stem cells and episomes now where people reversed aging quite a bit. And it's just the regulation and safety in America, it's good that we're like trying to keep it safe and do no harm.
Yeah.
But then you got people going to like Antigua or Colombia to get these treatments.
Yeah.
And I think they're working on those studies now in America. So, and some of the peptides, they help with longevity, but there's other things too to come, It's exciting, the future.
No, I'm learning more and more about them. I don't know as much as you, but I'm trying to learn more. And then, because we are kind of a little bit tight on time, but I want to, for people that are watching, if they want to come see you, how do they reach you?
Yeah, so they can go to enhancepsych.com, or they can hit me up on. I have also a podcast I have to bring you on.
Okay, yeah, for sure. I love that.
Yeah, The Happiness of Pursuit, and it's, YouTube, Spotify, and then just at Dr. Enhance Psych.
Okay,
And on all the socials. So.
And then I always ask everyone, so what is your, I believe I believe kind of in manifestation or visions, or just so that you can kind of create a future. Do you have a 5-year vision for your future or goals?
Yeah, so we're working on scaling. So Enhance Psych, then I got into peptides. I'm just following my passion here and like wanting to incorporate mental health treatment, but also what I see is like these amazing compounds and longevity solutions. And so we're going to try to scale more brick and mortar locations and then digitally serve more people, like starting through Florida, and then we'll see from there how far we can go, but maybe try to put a few brick and mortar locations at least in the next year, and hopefully it'll work out and we can keep going.
Awesome. That's super exciting. And then do you have a favorite quote that you want to share?
Honestly, this week's been a rough one. It's weeks where just like it feels like it's up and down, everything's going on. So I was like, so the one of course, it's my pleasure. To me, this week was about like it's supposed to be hard.
Okay.
And otherwise everyone would do it. And like Winston Churchill's like, when you're going through hell, keep going.
And that's a great one.
And you'll get through. It's like
that is a great
one.
And
then it makes you stronger. And I know you talked a lot about this too. Like that's where the growth is when you've gone through tough stuff. And if you had an easy life, there'd be no point, right? There'd be no growth.
For sure. Well, thank you so much for coming, and we'll make sure that we have all the links so people can come get help from you. And I really appreciate your expertise and your time.
Thank you.
Thank you for watching.